So, Dr. Sturm, thank you so much for being with us today. I've heard so much about you, and I don't know if I'm more nervous about talking about medicine side or the podcast side of you, but let's start with the medicine side.
Well, I'm excited to be here. Thank you for inviting me.
Of course.
I was so excited whenever Freddie let me know.
Oh.
So yeah, I do facial plastics. That means that in my training, I did ENT and then did specialization in facial plastics. So I do all the things that make us feel good about ourselves from neck up. And so that's one part of what I do. And then just started doing the podcasting, I don't know, maybe like a year ago, as a way to... I'd always felt like I have such a great job that I get to talk to people all day. Like 90% of my job is talking to people. And it's like, there's so many interesting people with stories and things that they've done. And, like yourself, have done so much. So I'm like, I get to talk to people.
But aren't you talking mainly about their procedures or?
Some, I like to mix in both of like a little bit of life, a little bit of who they are,
So
they
I've listened to a few, but I'm focused on the procedure.
Yeah. The ones I do by myself, I talk a lot about the procedures, but I've had some guests on, and that's where the idea started. Is like, oh, I have all these wonderful people that I've met along the way, and I love their stories and love to tell their story. And, they've had procedures, and we can talk about that, but also like, how did you get to this point? And, it's kind of evolved into a few different things.
Now, were you a psychiatrist on the other side?
Well, in plastics, you have to be a little bit of it.
Oh, right.
Because people will come in and they get their Botox, but then we also talk about life and everything that's going on, and especially facial plastics, because it has a lot to do with like who you are, how you see yourself, how the world sees you, within your gender, your ethnicity, all of those things tie into your face. And so it's kind of one of the things that I liked about facial plastics is it is a little bit of that like psychology, getting to know people. Like I have to have more of a conversation with someone than like, oh, you want some lipo? Yeah, this is what we can make it look like,
Okay, what would be a question you'd ask a patient?
Like especially with noses, because that conveys a lot about who we are, our gender, all of those things, okay, so what are you looking for? What looks like a nice nose to you? What does, especially if someone's coming, from a different ethnicity than me, like what aspects of that do you like and you want to retain? What aspects of it do you want to change? How do you want that to look? I'll even ask people like, who's supporting you in this decision? How are we, how is everybody?
Why is that important?
Because it's not for them, but it does make a difference recovery-wise if you change something that everybody else in your family has and maybe they're not supportive. So have you had the conversation with them? Have you not? Are you okay with that?
Oh, interesting.
Because you go home and you're like, yeah, I got this great new nose, and they're not happy about it, and so we're very vulnerable right afterwards after you get something like that done, and you're like, okay, I think this is a good decision. I hope this is a good decision. You're in the recovery period. It doesn't look like it's going to at the end, and you're, so you have that little insecurity. And so if you go home and someone's like, why'd you do that? That is really going to affect you. And so I like to try to have that conversation up front of like, okay, well, who all have you talked to? Where are you at? It's good for me if I can see like their support system come in with them. And then I know, okay, everybody's on the same page. You're beautiful. You don't have to do this. Everyone agrees, but if you want to, we're here for you, and we know you're going to look a little different. And then in the end, it'll look like you, but, just refined, and having that cheerleader, because after any surgery, you don't feel great, right. And having that person that's like, it's going to be good. This is right. It's going to be okay.
How do you prepare the supporter? Do you spend time with them at all?
That's the ideal situation, is that they come in, and if they didn't come in for like the consultation, I always tell them, if you want to go home and talk to your husband or your whoever, feel free to come back. Like, please bring them back, and we'll talk together, because that to me is the most effective. If we can all sit and talk together, and what are your concerns and what are your worries, and and like just put it all out on the table. And that's the best situation for me, is if we can all sit and talk about it. Because I have like a imaging program where it's kind of like Photoshop and show them and say, okay, this is what I think we can do. And,
High tech here.
it's so fun. But then get everybody kind of buy into it and idea of like.
Have you ever turned someone down?
Yeah, if it's something that I don't think is a good idea, something that I don't think aligns with, my aesthetic, or if it's something that I'll be honest with people and say, I do it, it's not my favorite thing to do. But I know someone who's real good at it. I want to do the things that I feel really good about, that I do all the time, that I'm really comfortable with, that I'm like, yeah, I'm excited, you're excited, this is going to be amazing. But if it's something that, I can do, I have done it, but you want to go to somebody's excited about it,
All right, so we've jumped around here.
Sorry.
What attracted you to medicine? Did you always want to be a physician, or?
So growing up, I grew up in a small town in West Texas, and the medical care was okay, but it's difficult to attract people to come to a town where maybe there's not a lot going on, and they try to accommodate with the pay as much as possible, but it's just not as exciting as maybe going to a big city. So medical care was okay. My grandmother was a diabetic, so she was kind of in and out of the hospital, and I kind of got to see that side of medicine, of care, and different doctors, and how people talk to you and how people treat you and that sort of thing. And I was sort of interested in it, and I was in high school, and I got really sick, and I think it was like with allergies, and I go to the doctor, and I told him my uvula is so swollen, it's like laying on my tongue. And he looked at me like I had 3 heads, and he was like, "You're what?" And I was like, "The uvula, the thing that hangs down in the back of your throat." And he just still looked at me very blankly. And maybe it's because it was coming from a high school student. He was like, "Why are you saying?" But I thought, man, if this guy can do it, like I can do it. This can't be that hard, I could do that job. And just kind of got interested in it. In college, I thought I wanted to do like an MD, PhD, and was doing research. And I still like the research, but on a Saturday with me and the mice in the lab was not what I wanted to do. I like being around people and talking to people, and so realized the PhD maybe was not my thing, but the MD I really liked and enjoyed, and decided that's what I wanted.
So what convinced you to go to facial?
I was going to be an OB-GYN and decided that's what I wanted to do because I really like working with women.
Wait, OB-GYN to surgeon to facial, that's a big jump.
It started with ER, so it was really far. You just don't know when you go to med school. You think, I want to help people, but you don't know what that means, And I think once you're exposed to surgery, either you love it and it's the most interesting thing you've ever seen, or it is not for you. It's usually one or the other, And so I was just enthralled, like this was so fascinating, and you can like physically help someone right now. I can help you with my hands to help you get better, And so that was something I really liked about it. And I liked working with women. So I thought, okay, well, I like OB-GYN. I like that I can see them in clinic. I get to have a relationship with them. I get to be a part of a really special part of their life, having babies. And I liked both aspects. Like I didn't like just doing surgery or just being in clinic. I liked having both. And then I did a rotation where I saw this guy take a rib and carve it into an ear. And I thought, that is really the coolest thing I've ever seen. Like you made an ear for a kid today that didn't have an ear. And I was like, how was your day? I made an ear. Like, that's a great day.
Yeah. Absolutely.
Yeah. So I was like, oh, I'm interested in this. And I get to do all of those things. I get to see people in clinic, and I have patients that I've done their Botox for almost 15 years now. So, I like really know them very well. And then I get to do surgery. I can physically help people feel better about themselves. And I get a little bit of everything. Most of my patients are women. I do have men patients, but most of them are women, and I help them like feel better about themselves, which kind of checks all the boxes.
Yes. So this feeling better about yourself, why is that so important?
Because it's not just fixing this one thing in your life, it spills over to everything. Like if you're confident, you're going to perform better at work. You're going to, and this is my opinion, you show up better for your partner, show up better for the people around you, because that's energy that you're not thinking about, oh, I'm worried about this or about that. I always tell people, like, it's the taking pictures where I want you to take a picture and not worry about what side, what angle,
Yeah.
that you're just there and you're living in the moment and you're not thinking about, oh, my nose and don't get the profile. This is my good side. This is my, you just take the picture, if I can take away a little bit of that stress from somebody, of that thing that they're self-conscious about, you can use that energy some other way,
And do you think there used to be a bit of a stigma to all this? Do you think that's gone?
Not gone, but it's better. I think it's better.
Yes.
I think with, there's pros and cons of social media, but I think people sharing more of this, and I think, honestly, people seeing good results of plastic surgery, I think that's helped, because before we would just see the ones that everyone knew. Like everybody knows you had to work, and everybody does not think that is what they want to do.
Right.
Yeah. They'll come in and be like, not that person. This is what I don't want to look like. So I think having some of those examples where you're like, that person definitely had work because they didn't look like that before, but they look really good,
Yeah.
Take some of that stigma and a little bit of fear away of like, I don't want to not look like myself too, So I think it's better. I still think there's, hesitations and concerns, and I think that'll always be there, but I think people are more accepting of it and more accepting of, if you can change something and feel better about yourself, that's okay. And now,
And in the world I'm in now, body image is a big deal. But it spills over to the entire body. And I know you have a lot of different services. The one that fascinated me was the hair trim. Is it actually treatment, or is it transplants, or what is it you do with the hair? And never would I have associated it with with what you were doing. I think, I'm going to find all these other things. What is that?
Yeah. So we have a range of things that we can do, because it's not a one size fits all. So we have everything from like supplements, if you're like, oh, I'm just shedding more than I did before, to like non-invasive treatments we can do in the office. And I actually really like non-invasive treatments for women, especially if your hair's fallen out because of medications or chemo or stress or thyroid or you name it.
Right.
We have a list 2 pages long of reasons why our hair can be thin. So usually the follicle is there. I know men, it's like 3 reasons. Women, it's 2 pages.
My goodness. Well, one of my questions was going to be about if a survivor could use this, and you said chemo.
Yeah.
All right, so stay in explaining it to me.
So once you finished everything and your doctors say, you can do the treatments. So there's a few different ways to do it. So we stimulate those follicles to grow again, because they've gone into the resting phase because of the medications and everything. And so the follicle's there, it can grow a hair. We just need to give it a little boost. And so we have different ways. We can do microneedling. It's like a little pin that has these teeny tiny little needles that, and you don't have to go in very deep. So as far as pain, it's minimal. It feels like vibration is what it feels like. And it creates these little channels. So just doing that helps stimulate the cells to grow, or the follicles to grow. But then we'll also put other, we have peptides and we have little growth factors, and we have different serums that help that have been made specially for hair growth. And so then we massage your scalp, which feels kind of nice.
Oh, yeah.
Massage it in, and then it goes in those channels down to the hair follicles. And I'm usually a skeptic. So I was a skeptic. I was like, I don't know. That sounds a little like chicken footy, for me. And the results have been really good. It's not like you were 20, but it's definitely significantly better, where you're not seeing the scalp as much. You're having more hair growth, and you have more hairs that are growing, and the hairs that are growing are wider in diameter, so they're taking up more space. So we have that, and then there's lasers that kind of work in the same way of making those little channels, and there's a bunch of different serums we can use. I love that for people that have had cancer and for women in general, because the follicles are there, So that is like my first go-to for anybody in that category. And then we do hair transplant. And so that's more for people that, you know, you used to have hair here, and then now we don't have hair here anymore, you know, and so we can take the hair from the back and the sides and transplant it in here and fill in. And we do that everywhere. So we can do it in eyebrows. We've done it for beards. We've done it for, you can put the hair wherever you want it to go.
You're kidding.
And it works great. You know, the eyebrows are amazing because it frames your eyes and it makes such a big difference.
Well, and I know so many women after chemo have lost a lot of hair, and it just never seems to come back, you know, and so that is so fascinating. Oh my goodness.
Yeah.
I was so impressed, and, you know, I can tell you're pretty modest, but, you know, you've been the head of major groups that are in your profession. You've that's a heavyweight. That's heavyweight type stuff outside of your own practice, and you're volunteering everywhere. And there's a pattern in some of your volunteering, and it all wraps around women. So any insight you can give us on what makes you choose things that are going to impact women the most?
I feel like systemically, and especially probably coming from like the medical background, a lot of that lens is the baseline is men, you know, and then, oh, well, women's heart disease presents differently. Oh, this presents differently. You may react to medications differently, as opposed to having more of a global lens. And so I think maybe that background of seeing that, and then just some of the discrepancies between like our ability, upward mobility in leadership positions and things like that, that I see there. We need a little bit more boosting up, you know. When I was interviewing for fellowship, there was only 40 programs. I think there's 60 now. There's 40 programs in the U.S. And of everywhere I interviewed, and I interviewed like 15 places because I wanted to make sure I matched. There was one that had a co-director that was a woman. She wasn't in charge. She was just the co-director. And that was it out of all those programs.
Oh my goodness.
And so that was one of the things at the time that I was like, there should be more, you know. And in it's a tiny little specialty, but it's changed a lot over the last 5 years, but it's really been an old boys club for a long time. So it was one of those things of like, we need to get more women involved. Like, this is such a great space for women, you know, facial plastics, and most of our patients are women, and we understand. And a lot of my patients will say, well, I feel more comfortable going to someone that I feel like, you know, understands what I'm saying. And so it's been from that background of, we need more women doing this.
Now, how long ago was it when you were applying for fellowship?
Gosh, okay. I've been in practice almost 15 years, and then it was 2 or 3 years before that. So 17 or 18 years ago.
See, that just astounds me because it sounds so much just like the 80s.
I know. And it wasn't
just,
that long ago.
Oh
And
my
it's
gosh.
literally the past 5 years that we've had more women in leadership in our specialty. And there was pushback. They were not
Even
happy
now?
about it. Yes, they're not
Really?
happy. We've wore them down a little bit, so now it's more, you see it more, but not happy at all.
Just stunned. I mean, I don't know why. I've felt that, been in that world forever, but it just seems like that should be so over.
It should be so over. And there was a Zoom call. It's like 2020, and so everything was on Zoom, and we're on this call about adding a DEI representative to the board, and, you know, we just need to make sure everyone's represented. And to me, it's one of those things of like, yeah, every major corporation has already done this. Everybody's already done this. This should be a no-brainer. And the 2-hour Zoom call that we had to sit through of why that was not okay, and like, what year is it? You know, it's amazing. I don't understand.
And you're in one of the most revered professional worlds there is. I mean, think about that. That's scary.
Medicine's very resistant to change. I think we don't like change, and it's slow.
Well, thank goodness you're forging that
Yeah.
path.
Yes.
For all the rest that are coming along. My goodness.
Yeah.
All right, talk to us a little bit. I know you're one of the things that fascinated me on your resume was you volunteer with an ovarian cancer group,
Yeah.
and we're hearing more and more about how many older women this is happening in. Maybe it's not a world I've been in. Maybe that's why I'm going. How's this going on?
And even I've heard of more people my age. I don't know, honestly, I don't know why, but I'm hearing it more and you're seeing it more. And it's just such an awful disease because it's so insidious and you have these symptoms that could be anything. And maybe they're like, oh, you're fine. And, it makes you paranoid a little bit because you're like, it's like bloating. I don't know. You know what I mean? And I have some patients that are survivors and they're amazing and just, super inspirational. That was one reason why I got into it, of like talking with the patients. And
so what does that group do exactly?
So they raise money for like education and to fund people going through the treatment. To help them with their treatments and how expensive everything is.
Yeah, it is. And so many of our breast cancer survivors are concerned about that. I mean, because there's such a connect.
Yeah,
or
absolutely.
they have a family member who's had it, and they're going, how did this happen with my breast cancer? There's always those questions.
Yeah.
Yeah. I'm glad you're in that world, too, because that needs a lot of education.
Yeah, I know. And because a lot of people don't know.
But it's just like anything you get. If you don't know about it, you need someone to help you navigate through all of that. Now, you said a while ago you just like talking to people. It had to be more than that. That would get you. You know how much work it is. It's like another full-time job, isn't it? Even when you have a decent producer.
And they do a lot.
They do a lot. For our listeners, we both have the same producer.
Yeah, who's amazing.
Yes, and he is. But we don't ever tell him that.
No. Can't feed his ego too much.
It would. And I mention him often on this show because he's the one that got us started.
Oh, yeah.
Yeah, he came with his little presentation, and I said, if you're trying to sell me something, Freddie, you're going to have to come to me. So he comes, and I went, God, that's been on my goal list for 3 years. So did you have, like me, a goal list?
That was kind of what happened.
Really?
Because I'd been thinking about it and talking to my Dr. Hamill's in my office, and we'd talked about it before. And then I met Freddie at a fundraiser, and I was like, oh, yeah, I've been wanting to do that. So it's so funny you said that.
Yeah. So how do you pick your guest?
So I picked people that are kind of in my sphere and that I think are interesting. People that I know that are patients, people that I've just met throughout, like networking and that sort of thing, that I just feel like they're very interesting. And the ideal person's that has been a patient, and knows what that process is like and can talk about that, but also has like an interesting story. Like I have a friend that is a patient, but also does like breath work, which I think is super interesting. And, like, what does that mean and how can you use it? And, thinking about life in this bigger way. And
it isn't just all about the surgeries you're interested in things that help us navigate life, help us get through it.
Yeah, because we're all just getting through it, and how do we figure those things out? And how, like I learned so much from my patients, and so that was a big thing for me. It's like I learned from them, and I think it's interesting, and I think I would love to share their stories if they're willing to share them.
Yeah, and what I find out, and I've been doing this 40 years at the Rose, and I'll have someone come in who's been a volunteer for us or a supporter or a patient, and they'll tell me something. I go, how did I not know that? It's just amazing when people have that ability to share, and when it's their own story. And I've just been. It's been great for me. Yeah, and people are interesting.
Yeah.
Life is a lot more interesting than anything on the news.
Oh, yeah.
Guaranteed.
Oh, yeah.
Yeah.
I want to hear the life stuff way more than the news.
Oh, yeah. And that's what you do. You bring that out in your guest.
Yeah, I like to talk about, what they do and
So
people like
any
you.
super interesting episode that everyone should listen to? Don't say all, then I know you're a podcaster.
No, I do think the breathwork one is really interesting. I had Ashley Steinberg on. I think you know her.
Yes.
Yeah, she's hilarious.
She is.
Yeah.
I was worried I was going to have to put a,
I
hey,
know.
got to edit that. Okay, nope, we can't do that. But she's fun.
She's really
fun.
funny,
Mhm.
and so we talk about a lot of the different, because she likes to do the breast reconstruction and some of the stuff that you see online, and you're like, is this real? Is that real? What's
Yeah.
that one's really good. And then I have Anthony Brissett. He's the surgeon that I watched do the ear surgery,
Oh.
and now we're actually co-directors on our fellowship, and so stayed friends and colleagues, and now we work together with the fellowship. But was able to kind of talk to him about like his life, because he was a nurse and then went to medical school and came from Canada, and did a lot of different things, worked at Mayo, and like you said, people for years and don't have the time to like sit down and really ask them a lot of questions. So I think those are some of my favorites, I think.
What other hobby do you have?
I have 2 kids.
Oh, that's not a hobby. That's work.
Yeah, that's all my hobbies. They're 5 and 7, and so between like work and kids, sometimes I work out.
Oh, no, you're doing enough. Believe me. You
Yeah,
don't need much more.
they're wonderful, but that's
Yeah.
my,
That's your
they take-
priority.
yeah,
Absolutely.
they're funny, and people ask me all the time, do they know what I do? And I'm like, not really. They know I'm a doctor. They don't
Really?
Yeah,
No.
they're 5 and 7. They don't really understand.
Not yet, no. So for all of our listeners, and especially for those who have been through breast cancer, do you have any, if they were hesitant about seeking some of your different services, what would you say to them?
That it's the time to take care of yourself. You've been through a lot. You're strong. You've done more than most people even understand, and so it's okay to do something for yourself and feel good about everything you've done and you've accomplished. And we really work hard to make sure everybody feels comfortable in our office, and that you're comfortable with the plan and you're comfortable with everything you do. And so we give you a bunch of different options and, walk you through the process. And so that's one of the things we say is we don't like sell packages. We work with the patient to get your outcome. So it's totally okay to come in and talk and ask questions, and you should,
That's important, yes. Yes.
and if you and we're totally fine with, you got your information and whatever you want to do. Like none of it should be, that's one of the things, none of it should be like, you have to get plastic surgery. This is something you're doing for yourself, and you should feel good about every part of it. This is for me.
And that's a whole different way of saying that the me is important.
Yeah.
Yeah. Great advice. Thank you so much for being on Let's Talk About Your Breasts. This has been fun.
Yeah. Thank you for having me.
Of course.